procedures, different mentalities, a lot of differences, and we should have something in common, something to assure the end user, which is the patient, the transplant physician, but in the end it's the patient, that the cord lab he receives is the same, no matter if you took it from Sydney or if you took it from Paris or London. So the organization that stepped up to do that was FACT, with the cooperation of Network, to establish the first rules, the first standards for cord blood banking. FACT is the Foundation of Accreditation for Cellular Therapy in the US. Network was founded by the cord blood banks and it's mainly based in Europe. You may know FACT from the close cooperation with JAC in the transplant centers. The goal of such accreditation is to ensure the high quality of the product that we support that. And when I mean high quality, it's not only not to be dangerous for the patient for contamination or anything else, but to have high therapeutic potential. And of course, it's harmonized a little bit the way cord blood bank works. It allows for great diversity, but there are some main things that all cord blood banks should follow. So, FACT Network, what actually focuses on is compliance with the standards that have been established, and that the procedures are done properly, and that means, excuse me, that there should be a quality management system to assure that we can prevent errors, we can follow errors. If they happen, we can detect them, we can correct them, that we can continuously improve our procedures, and the way to start a new corporate bank when you've never heard of corporate banking. Actually, your transplant physicians don't know about corporate banking and transplantation back in 2003 in Greece. Well, as I said before, there is not just one way, there are many ways, but in our conditions, this was the way, and probably it was the best way for us. So, I have step 0 here, because actually the first thing you do is ask for help. Help is always needed when you start something new. I know there are people here that have started things from scratch, set up laboratories, set up techniques, set up little things. I'm sure they would know better than me how much help is important at the beginning. I tell you the least of all things. There will be some time when you must prove that your personnel have been trained. Okay, who has trained them? Well, and who has trained the trainer? The easiest thing is to send someone somewhere or ask someone to come to train your personnel, or send someone to another bank, send someone to another facility where he can be trained, he can document his training, and when he comes back, he can start setting up things and start training the personnel. There are many banks that are willing to help. Most of them are. As I said, we have received lots of help at the beginning, and of course, we are in turn there for anybody who needs help. So, once you've done that, there are many things to put down in order to begin the bank. There are facilities, there are regulations, there is a infamous quality management plan. But some people would say that first of all, to start the bank, you have to have the facilities. I believe that's wrong. In order to start banking, actually, the only thing you need at the beginning is just one small room with centrifuge and a room for crime preservation. That's all you need at the beginning, because until you reach at the moment where you can say, I have validated my procedure and I can start banking for good, they'll have passed just enough time to organize it. The first things I believe that should be done is to define the structure of the bank, and when I say define the structure, first of all, regarding to other cooperating facilities, because a bank is not alone. A bank needs HLA typing, a bank needs microbial testing, a bank needs viral testing, hemoglobinopathy testing. Of course, a bank needs the registries in order to list the units. A bank needs the collection center in order to obtain for that unit. HLA typing, for example, has to be done according to the standards by an FEH or some other accreditation, some other way accredited laboratory. It's not easy to start, for example, a corporate bank and an HLA laboratory at the same time. You probably have to use a great HLA laboratory, that's what we have here. So all these cooperations, all these interactions between laboratories have to be well established. There have to be written agreements to show what are the responsibilities of each party. Second of all, organize the personnel. It's very important when you start something to know who is there and who is going to be there and stay with you for long term, because it requires a lot of work to organize that, and it's very good to have standard personnel. You need people building experience when the time comes. This experience will help the bank as entirely, because when time comes, for example, to write 160 SOPs, you will need experienced people to help you do that. Not one person can do that. So we have organized our bank in working functions, units, and the personnel is divided in these functions. Each function has specific job description. The core management unit is what controls entirely the other functions. And we have a team working in order to inform the parents, to recruit donors, and to manage generally donors. Another for the collections, to manage the collections, how are they done, when they arrive at the bank, how they are registered in all labs. Then there are the laboratories, the processing facility, and the crop preservation facility. And finally, there is a team working to communicate with registries, with transplant centers, send the list of CV units, obtain results, ship CV units to them. Of course, the core of the entire process the quality management unit, and it's the one that controls the compliance with the standards. As you see, different working functions have different sections of the standards to actually worry about. There is a part C that has to do with donor management and collections. So these teams are mainly interested in these two parts, in the implementation of these two parts of the standards. This part of the standards, the laboratory and the listing is another section. When you've done that, you define who you are, who you work with, what personnel you have. The next most important step is to find where to get core documents from. The collection center is the most important section of the core document. Many inspections have failed because there was a problem in the collection center. The laboratory is something you can control. It's 1 room, 2 rooms, 3 rooms, 10 people, several standard operating procedures. The collection center is something you cannot always control, especially if the core bank is detached from the collection center and they don't have very close relations. They will have many problems. There are two kinds of collections sites. The one is a fixed collection site and the other is a non-fixed. When I say fixed, it means that the bank cooperates closely with 1, 2, 3 maternity hospitals and collects core documents from them. Non-fixed is something more recent, let's say. To our knowledge, just us have implemented this, and 3 banks, mainly the others in the United States, will do that under as a research project to see how it can be done. But routinely, we use only non-fixed collection sites. According to the standards, the bank is responsible of how collections are done. No matter if it's a fixed or a non-fixed collection, no matter if there is a close cooperation between the maternity hospital and the corporate bank, the bank is responsible. That means the bank has to train the personnel that does the collection. Another option is to have bank personnel, bank nurses, bank midwives, bank doctors who are located in the collection center. But no matter what, the people who do the collection must be trained from the corporate bank. They must follow the procedures and the policies of the corporate bank. The parents must be formed by the corporate bank, even if it's by personnel of the corporate bank and hospital again. And they have to give their consent, of course, before the collection. And finally, the corporate bank is also responsible for the way the corporate comes from the maternity hospital to the central facility. All these are controlled by the company. So it must assure the competency and training of the personnel, establish the SOPs and policies, and continuously monitor how things are done. It's not just we give the SOPs and the policies, we have to see that these are followed, these are maintained, and they continue to perform as they should be. In case that they don't, we have to make adjustments. The responsibilities of the corporate bank towards the potential donor, the mother especially, find a way to overcome this, because the same standards apply to non-fixed collection site. First of all, we took out the information of potential donors up to ourselves entirely. We have several ways to do that. The website, we have informative material leaflets that we give to the parents, and of course, the most important and the main way to do that is by parents coming to our bank and following seminars. We have at least 5 seminars a week, in which we inform parents, we tell them all they need to know, we give them the documents, we give them the collection kit, and we give them and to explain, detail the procedure, how it should be done, and what they have to do. So, besides that, the potential information, the collection kit, and to register the donors, and some way we make them responsible for these standards to control. And what do I mean? First of all, inform the parents what they have to do themselves. Complete the forms, complete the medical history, complete the consent, complete all the documentation by themselves. The next thing is the parents are responsible and instructed, detailing, and are responsible for giving all the necessary material to the physician that will do the collection. Since we cannot train the physician because there are thousands of physicians doing collection and not in a fixed site, we can send him informative material. We can send him training material. We can send him leaflets. We can send him SOPs. We can even send him tests to check his competency once he has read and understood his material, and agreements in order to agree and do the collection. So this is the way we reach the doctors, we reach them through the parents, and that way they get their training material and they get all the equipment they need. Finally, when they collect them out, the parents are responsible for the next step, transportation of the cord blood unit to the cord blood bank. We have evaluated thermal isolated bag to do that. We have replaced the label that should be on the, according to the standards, the outer container that is used for transportation for the cord blood bank. It is printed on the thermal isolated bag, both in English and in Greek. So even the bag complies with standard. So when we've set up this difficulty, or when we've fixed that, the next step is set up the facilities. The facilities need to be adequate, sanitized, and first of all, mainly safe for the cord blood unit, but also for the personnel. It's very important that we all work in a safe environment. We have now expanded from the room we started at the beginning according to our needs. We can be very pleased if we want to system assures traceability of what that I said before and confidentiality, of course, of the data, so that there is no risk for that. And of course, it helps us manage all that. For example, we have all the donor data, and we have their cell counts in this program. We have their HLA typing, and the HLA typing of the marrow. Both the HLA typing of the cord that you require The volume of our units is increasing year by year. That is a good thing, especially since the non-fixed collection, we don't expect a very good training of the physicians. But that also means that there is an increase in the average cell number, and the more good units you have, the most chances you have to do to transplant a unit. At the moment, approximately 80% of the collected cord blood units are rejected. Because the main reason of rejection of cord blood units is the total number of nucleated cells. We accept units that after process have above 1 billion nucleated cells. That means they are suitable according to the transplantation at the moment, standards at the moment. They should be suitable for patients up to 30 to 33 kilograms. Of course, we have larger units than that, but our minimum is 1 billion cells. So once everything is in place, nothing holds us up to start the accreditation procedure. We have already sent our application, of course.
material you send, the bag, for example, will perform the same way as would perform a container used for the transportation between a hospital and the plant. And all the documentation is there. So it's